on. So when you hear the CDC director say this fall that children are at significant risk for COVID and should get the latest version of the COVID shot, what's your reaction?
Well, thank you for having me on, Ivory. And yes, I have many reactions with this. When you were discussing earlier about how sometimes when these individuals and children are admitted to the hospital, many times it's not being differentiated if they are being hospitalized for COVID or with COVID. And we do still understand and we know that these PCR tests that they are using to assess whether somebody is positive for COVID or not, they are not limiting how many PCR cycle thresholds they're using. And many times they're cycling them up so high that they are more likely to yield a false positive rate. So I really feel like they're not being transparent with the public. And again, like you said before, it is out in the open that these organizations are very much so captured by pharmaceutical industry.
And that leaves viewers, like my viewers, saying, wow, I'm going to avoid hospitals at all costs. You know, they have these, compromising interests that are not, in my best interest. But you have started the Functional Nurse Academy to help fill that void, right?
Absolutely. So, and again, I felt very driven by God to do this because we know that the conventional medical model has been lacking for several years. And during COVID, we really saw the corruption just shine through. And what really is something that affected me is I was seeing that other, holistic organizations and things like that still go in lockstep with the CDC. So I wanted to have a alternative educational platform for nurses that recognizes that just because the CDC, the FDA, the NIH says something, we don't need to pledge allegiance to that. And we need to recognize that these industries are captured and, help to really empower the patients that we work with to do their own independent research and make informed medical decisions.